evening, everybody. Welcome to another edition on the Inside View. Today, we are going to discuss an important topic that many of us are shying away from, even though it's claiming so many lives. You know, many years ago, when you hear of cancer, we associated it to the elderly, people maybe in their 70s, 80s. And we never thought cancer could affect many lives. But now we are getting to know that cancer has no respecter of persons. And it's affecting children, it's affecting, I'll say toddlers, teenagers, people of various ages. And, breast cancer is also no exception. So today we are going to actually talk about breast cancer, how breast cancer is really affecting many of our women, even though it affects men as well. But then women are, at more, I'll say, susceptible to breast cancer. So tonight I have with me a doctor who would actually lead us into this discussion. And she is Dr. Zainab Ganiyu-Dada. Welcome
Hi.
to the show.
Hi.
Yeah, good to see you. And how are you?
Good to see you. I'm very well, thank you. How are you?
I'm very, very, very well too.
Good.
I'm so, I'll say blessed to have you on the show. In spite of your busy schedule, you've managed to actually spare some time to educate us, and I'll say thank you so much.
My
And
pleasure.
if you're online, I would just urge you to share and invite as many people as possible to join in this important discussion. If if not for you at all, it can be for your mom, your grandmother, maybe your niece, and maybe your daughter. I mean, who knows? So please, let us share this link. Let us invite as many people as possible to join in this discussion. And also, please subscribe to the Inside View channel on YouTube, and let us all educate ourselves. Thank you. Dr. Zainab,
Hmm.
I'll say that many of us don't know you, and we
Yes,
just want to know a little bit about you. Who is Dr. Zainab? And just a little bit about your background. I mean, how you ended up being a doctor. If you can just tell us just a little bit about yourself.
sure. My name is Zainab. I'm a junior doctor currently working in South London in the NHS. I've been working for about 3 years now. I qualified 3 years ago and spent 6 years in medical school prior to that. I've done multiple different specialities. Most recently, I'm now doing a rotation in a GP. So I'm seeing a lot more community-based medicine, whereas before a lot of my background was spent in hospital, in acute medicine mostly, and a little bit of ward work as well, where I got to see different patients with different conditions. And I think seeing patients with different types of cancer is something that, for me, is quite common. And then the incidence of cancer is also common. It's not an uncommon disease. But I think what I found is that a lot of patients don't know a lot of the signs and symptoms of different types of cancers. I know today we're going to focus on breast cancer, but um, during the time that I've been working, I've noticed that things that seem common to me or obvious to me, I'm realizing that isn't necessarily that obvious to other people. So that's why I've come today with Nana to speak to you guys about the different types of signs, symptoms, and the different things that we can do to prevent and treat specifically breast cancer. So that's a little bit about me.
Wonderful. This I would say that this platform is also about empowering our young people. If any young girl out there wants to go into medicine, what kind of encouragement, but then maybe she's not too sure as to what to do with their lives. You
Mm.
knew, I mean, what you wanted to become. I mean, I'll say that's maybe at a very, very early age. But then, what would you say to any young girl out there who is not too sure as to what you, I'll say maybe the youth, as to what he or she wants to become. What, like, would you want to tell them before we go into today's
yeah,
topic, please?
of course. So when I was little, I didn't really know about lots and lots of different careers, that are obviously available. For me, it was kind of like a rigid structure, and medicine was also always something that I was very interested in. So it was something that I wanted to do for a really long time. And then, I went to primary school, secondary school, college, and had an interest in biology and the biomedical sciences. So that's specifically lab-based medicine and understanding more about human physiology and on a more cellular and molecular level. So I spent quite a few years in the biomedical field and a bit of time in research as well. And I think when I'm talking to young people and I'm trying to sort of get them to decide what they want to do and how they want to move forward with their careers, it's important for you to follow what you're passionate about. And when it comes to STEM topics, so that's science, technology, and mathematics and engineering, those kind of things are very, very broad in what you can do. So you might like aspects of medicine and you might want to be a doctor, but you also might like aspects of medicine, but you want to know what else it is you can do. So I think what's really, really important when you're looking to decide on a career is do a bit of research. Spend some time with the people who are from that particular area. So try and get some time with some research scientists, some biomedical scientists, some doctors, some nurses, some midwives, researchers, so many different things. I think having a very good understanding and breadth of the different kind of roles that are available to you will help you make a better and informed decision about what it is that you want to do with your career and your life moving forward. So you don't have any kind of unexpected things and things you weren't necessarily prepared for or had considered. So for some people, they might see being a doctor as quite black and white. You go to school, you go to university, you graduate, you work, and that's it. There's a lot more to it than that. There's a lot of other things that maybe you wouldn't necessarily consider, such as, having to pick a speciality. When you're, 8, 9, 10, you just think, I just want to be a doctor. But there's a lot more to it. There's different specialities that you can pick. There's different ways that you can go around becoming a doctor. Even when you graduate, there's different ways of practicing medicine. Some people part-time, some people are full-time, some people do a bit of research, some people do private work, some people work exclusively for the NHS. So it varies across the board. So the key thing I'm saying here is do your research and talk to people who are actively working in that area and look for opportunities to enhance your knowledge. So a lot of universities now are doing like taster days or summer schools that are often free or can be free for people from lower income backgrounds. And that gives them an opportunity to explore lots of different careers and different options that they might have available to them and different ways of getting to those places as well. So I think, taking advantage of the opportunities that are in front of you and making sure that you do your research is very, very important. And also, don't ever think that you're not good enough to do something because there are always naysayers. There are always people that will say, you're this, you're that, you can't be that. And it's simply not true. Me being female and me being Black African means that I am in the minority in my workplace in terms of being represented. There are a lot of men, especially in more senior positions. More junior, there are in fact actually more women now. But in more senior positions, it's mostly male dominated. So it's not easy to kind of get into that space and feel like you're completely a part of that group of people, but you absolutely deserve to be there and belong there just as much as anyone else, regardless of your background, regardless of your gender, regardless of your skin tone. None of those things are important. It's what's up here that counts, and your commitment and your passion to do whatever it is that you want to do. So yeah, so that's it really. That's a little bit of advice I would give to young people.
Wonderful. So let's zoom into today's discussion. We are going to talk about breast cancer. What is breast cancer?
So if we were to go in the textbook type way of thinking about it, breast cancer basically is the abnormal proliferation, so the reproducing of cells in a way that is dysfunctional. So we have normal breast tissue, which is very glandular and has many different constituents to it. And breast cancer basically is a deviation away from that. So you have cells that originated in the breast, but are now not behaving like they're in the breast, and they proliferate and will grow in such a way that means that they're not functional as any kind of organ or body part, and they're detrimental to the health of whoever they are growing in. And when I talk about breast cancer, there's many different types. So you can have a breast cancer that's what we call in situ. So that's a breast cancer that stays in one particular area, but may still need to be excised. And there's a type of breast cancer that can spread and move around different parts of the body. And the term for that is called metastases. And that's where you have something that originated in one part of the body, but then will spread and grow in another part of the body. So breast cancer basically is that the cells originate in the breast, they are no longer functioning as breast cells and are detrimental to the health of the person in which they're growing.
Do you know what? I'll say that many years ago, it was so difficult to hear of cancer in the, the minority community. I'll say that. But for some reason now it's everywhere. What do you think are the attributes of this should I say endemic? Because I just want to know whether maybe it's got to do with our foods now, or maybe our lifestyle. Why the sudden increase in our communities?
It's multifactorial. So there are many different causes of cancer in general, and more specifically breast cancer. So there is a genetic predisposition to breast cancer. So there'll be some people who are more likely to get breast cancer than someone else. And that might be because they have other people in their family that have had it. So it might be an aunt, a mother, a sister, a grandparent, any of those things. So there's a genetic predisposition. And in those situations, we're very limited in what we can do for these people initially. So we would start with genetic testing and then consider the options and the risks and benefits of proceeding with treatment, surgery, etc. Other causes are things that are indirect causes of cancers in general. So that would be changes in lifestyle from what we used to do. So a lot of processed foods, sedentary lifestyles, less exercising generally, and just the type of food that we consume. So a lot of the food that we consume is processed. So even with the best will, we will all consume processed food to some extent, even if we're picking the best version of it. Ideally, you want to cook your own food. You know exactly what's in it. You know exactly how much of each ingredient is present, and you can trace the origins of whatever you've cooked at the end. So you can say, I've cooked this casserole and I know that this, and this is in it. And you can count the ingredients probably on one hand. Whereas if you were to buy a casserole from a shop, it would have lots of other things in it. It's been preserved, etc., etc. And constantly eating very processed foods, especially confectionery type things, crisps, cakes, very processed ready meals, those things can all contribute to limiting the amount of good things that your body can have that can promote good health. So having lots of food that have that are very fresh, they'll have a lot of vitamins, minerals, antioxidants, etc. Lots of these buzzwords that we hear about, they're actually very important in terms of being able to help us remain well. And a lot of the supplements that we're sometimes encouraged to have are not always necessary. For most people, having a varied and balanced diet is the best way to remain healthy. A lot of supplements are usually for specific groups of people at specific times. So, for example, women who are considering pregnancy or who are in early pregnancy, we encourage them to take folic acid because there's a direct benefit in having that supplement. It reduces incidences of spina bifida. So there's a direct link between low folate levels and congenital problems in the fetus. So that's just one example. But generally, I would say focusing on a good and balanced diet that has a good range of fresh ingredients and your 5 a day fruit and veg. And if you can have more, that's even better. Those things will ultimately help you, along with the other things that I said. So reducing the amount of time that you stay sitting in one position and doing more exercise instead, and just being mindful of what you do consume. So smoking as well is something that will damage the body, and it's not just the lungs. It damages the various cells in the body and their ability to replicate properly without being dysfunctional next time they replicate. And consuming alcohol as well is something that can be detrimental to health for a variety of reasons, including heart health and risk of diabetes, etc. Because alcohol contains a lot of sugar. And if you're trying to reduce the amount of sugar in your diet, it's very easy to consume a lot of sugar if it's in a liquid form. So, that starts us to think about not just alcohol, but fizzy drinks. So drinks that aren't sugar-free. So your Coca-Colas, your Fantas, your Lilts, all of those things that aren't the zero versions, those ones can also contribute to poor health long term as well. So when it comes to reducing your risk of cancer in general, it's important to have a healthy, balanced diet, have lots of exercise, and assess your risk in terms of your family risk. If you are at increased risk, there are certain programs within the NHS that run in terms of screening programs that might be specific to you. So if you think that you have an increased risk of breast cancer or other types of cancer, because you have a family history of that, I would say speak to your GP and they'll be able to tell you if it's something that needs or warrants further investigation, or if it's something that you should just monitor like anyone else in the community. So so that's a bit about breast cancer and trying to find ways to reduce its prevalence.
Great. Because of time, we might have to stick to the structure that this discussion actually needs to actually go to. If you have any questions, please don't hesitate to send your questions over. I've already seen comments coming in, but then if you have any questions for Dr. Zainab, please don't hesitate to put them across. And also, Dr. Zainab, I've sent you the link where you can share what you're humbling.
Yes.
Please. Yeah. So now let's move into the symptoms or the early detection of cancer. So we just want to find out who gets breast cancer and also what are the symptoms of it.
So a lot of people don't realize this, but men and women can get breast cancer. So the incidence in men is a lot lower than the incidence in women, but it's not negligible by any stretch of the imagination. So one thing to be mindful of is any kind of change in the breast area is something that warrants further investigation. So the types of people who will get breast cancer tend to be people who are older, So the 50 plus range, which is why we have a screening program where women will have what we call a mammogram, which is basically an x-ray of the breast. It's a procedure whereby the breasts are pushed together slightly so that we can take an image that basically shows us the whole architecture of the breast and allows us to see if there's anything in there that looks suspicious. So it's that group of women that are more likely to have breast cancer. Having said that, it can occur in much younger age groups. So you can have people from teenagers into their 20s, 30s, 40s who can also have breast cancer. So it's a wide range of people that can have breast cancer, and it goes across ethnicities as well. There are some incidences where breast cancer is higher in certain countries than others. So, for example, Moroccan women have a very high incidence of breast cancer, and that again is multifactorial. So that's genetics, environment, etc. There's lots of different things that go into that, but the the message I want to get across is that breast cancer can affect almost anyone at a variety of ages. So it's important for us to be aware of that and to be aware of the signs and symptoms, etc., which Nana will get onto shortly.
Wonderful. What signs of breast cancer? Other than a lump, because most of the times we think that having recognized maybe a lump just in your breasts actually means that you've got, cancer.
Mm.
What other signs other than the lump shows that maybe you've got cancer in your breast?
Yeah, so there's a multitude of signs actually. So a lump is just one of many things. So you can also have discharge from the nipple. That might be white, it might be green, it might be red. Um, Discharge from the nipple can be normal. If you're pregnant, you're in the last trimester, if you've just given birth, if you're breastfeeding, those are all reasons that you might have discharge from the nipple. However, if you are worried in any way, I would encourage you to see your GP. So that's one sign. Another sign would be if the nipple changes shape. So if the nipple seems to go inwards in itself, that's another sign that something might be slightly wrong. Another sign is the lump in the breast. But having said that, not all lumps in the breast are cancerous. So, for example, a lot of young women have something called what we call them breast mice. So, they're basically a collection of breast tissue that is highly mobile and can move around when you touch it. The difference between that and something that's more sinister is something that's fixed in place and can't move around. And those things would warrant further investigation. So other signs would be one breast looking different to the other when normally they looked very similar. There is asymmetrical breasts everywhere. So everyone has asymmetrical breasts. They're not exactly the same. It's a deviation from what's normal to you is something that you need to be concerned about. Also dimpling in the skin, so a type of orange peel skin, we call it. That again is another sign that there might be something not quite right going on with the breasts as well. And in addition to that, anything that you think just doesn't look right with your breasts or doesn't feel right with your breasts. And that includes the very back of your breasts to your rib cage. All of that area is breast tissue, including the armpits as well. So, feeling in the armpits, if you feel any lumps in the armpits or something doesn't feel right, that again could be a sign. Unilateral pain in a breast, so pain on one breast and not the other, could be something that warrants further investigation. It's quite normal as the month progresses for your breast to change shape slightly and to sometimes be a bit tender and for the nipples to be a bit tender as well. And that's all to do with hormonal changes, and that's very normal. But if you're getting something that's outside of what's normal for you should just go to your GP and just get them to have a look and to reassure you. One thing I would say though is that you should know what your breasts feel like over the course of the whole month. And the best way to do that is when you're having a shower, you're able to feel the whole breast architecture, including the armpits as well. And you'll know how that feels at the beginning of your cycle compared to the middle of your cycle compared to the end of the cycle.
Mhm.
And that will give you a much better idea of what is normal for you and what starts to feel abnormal so that you can get a hold of anything that's abnormal early on. So the key here is getting hold of any signs and symptoms early as opposed to waiting and watching and waiting and watching. The sooner you get diagnosed, the more treatment options are available, and the more likely there is that person will survive breast cancer for a number of years.
Wonderful. I think it's so easy for women with, I would say, normal size. I mean, normal size in terms of, I mean, not to be really endowed. I think you know what I'm talking about. You know, like women
Yes.
with just a normal size. I think for them it's so easy to, you know, examine themselves. But then when you have large breasts or big breasts, it becomes a bit tricky in terms of trying to examine yourself.
Mm-hmm.
I mean, in that case, do you think it's sometimes with are there any other is there any other way that women with large breasts can have themselves examined, not necessarily maybe by themselves or maybe by doctors? Because sometimes, you know, these women, by the time they realize that, look, they've got cancer because they were not able to detect that lump themselves. Don't
Mm-hmm.
you think that maybe in our community, because we tend to have, you know, those bigger boobs, women in that category should be given a little bit of, um, should I say, priority in terms of if they complain of such pain, maybe in their breast? Because sometimes, look, they'll say that, okay, you're not even yet up to 40, maybe you're in your 32, 35, or whatever it is.
Mm-hmm.
But you might tend to, you know, I'll say maybe later on, they will have this cancer. And then they will come back and say, oh, you should have gone, I was like actually going to see your doctor a bit early. But
Mm-hmm.
I don't know. But if there can be a way that women with bigger breasts, you know, be called to examine maybe from time to time instead of just waiting to be in their late 50s or 60s, because by that time would have been too late. So if there's any, I don't know, maybe such advice or maybe recommendation that maybe you can actually maybe pass it on, maybe for women with large breasts, how they
Mm-hmm.
can, because I mean, it's so difficult to examine your own breast. You know, like if you have large breasts, it's
Yes,
so difficult.
I know, absolutely. So there's a few things here. So in terms of the woman as an individual,
Mm-hmm.
when it comes to examining larger breasts, I think literally separating things into quadrants. So this is how we would do it as clinicians. We would, when we examine the breast in 4 areas. So you have the top of the breast on the right, the top of the breast on the left, the bottom of the breast on the left, the bottom of the breast on the right. So, and I think if you have larger breasts, sectioning the breast up in the same way and getting to understand what the part of your breast near your armpit feels like compared to the part of the breast near your breastbone in the center feels like, compared to how it feels like in the nipple, then underneath, and then to the edge as well. So taking things step by step is really important rather than just simply feeling the breasts and assuming that that's enough. You have to be systematic in how you do it, which is why we say doing it in the shower is good, because it's an opportunity to actually feel the breasts in a way that is in a relaxed and easy environment to feel the whole breast. So you're not wearing clothing, you're not having anything that constricts you. So sectioning the breast into 4 sections and then knowing what is normal for you and also knowing how the nipple feels as well. All of those things, that's how we would typically examine it as clinicians. And I would encourage women with larger breasts to take a similar approach as well. The other thing as well, which some people may not even consider, is that your husbands, your partners, they know what your breasts are like. They know what they normally feel like. And a lot of the times, like, it's not anecdotal, there's a lot of times where a lot of women might not be aware of a change in their breasts, but their partners are. And so they might then say to their wife, something feels a bit different. This is not how your breasts would normally feel. So, you know, if you're shy about talking to other people about your breasts, having a partner who knows your breasts very well, let's be honest, um, is also a good way of being able to monitor what your breasts are like. Having said all of this, if you are concerned about any kind of change in your breasts, or you're not clear about anything, I would definitely recommend speaking to your GP so that you can get more clarity in what is best for you as an individual.
Okay. Wow. So which breast is more prone to cancer? Because
It's
some people
equal.
just tell you. Are you sure? Because I think during my research and some of the recommendation, look, I wouldn't say recommendations, but the information that people actually sent to me is, most of them actually got their cancers on their left, breast. So, I mean, how far is that true? That the left breast is more, prone to cancer. How far is that true?
So that's not something that I've personally heard about. And I wouldn't encourage people to focus on one breast as opposed to another. I think it's really important that, like I said, you're systematic in the examination of your breasts.
Mm.
And rather than relying on um, a little bit of evidence that might show that one is more than the other, the general consensus that we want to get across to people is that regular examination of both breasts is the best way to prevent cancer, and not focusing on one or the other, because there are plenty of women who have it in the right breast, for example. And if they're spending all their time on the left breast, they're not going to know that.
Wow. Okay. I don't know if anyone has got any question for us, but other than that, Dr. Zainab, if you can maybe move on to your own structure that you have in terms of the risks and the prevention, and what do we have? Early detection, diagnosis, I think, which you've already spoke about. So if you can just move on to the risks and prevention.
Yeah. So my main way of focusing this discussion is via the NHS UK website. So it's a very, very good website for educating people in terms of various diseases, including, how they're diagnosed, how they're treated, how they're managed long term, and what kind of prognosis they can have. So specifically on the NHS website about breast cancer, there's an awful lot of information. So I have a printout here just of one of the pages that you can just about see there. So this is just one of the pages that talks about the symptoms of it. So I'll show you again so you can see it. So this is just one talking about the symptoms, as we discussed earlier. And there's many pages on that website that go through the causes, treatment options, way to prevent it, living with cancer as well, because ultimately that is a reality for a lot of people, how to manage those kind of things, and just kind of moving forward and feeling like you have the right information and support. So as I said earlier, we've talked a bit about symptoms. If we move on to causes, I discussed a little bit about age
Sure.
being an important factor. When it comes to diagnosing breast cancer, between 50 and 70 is when they have mammograms. If some women want to continue mammograms past 70, there are ways to do that through their GP. And it depends on which area in the country you are as to exactly what age you start. So it might be a little bit past 50 and it might be a little bit past 70, depending on where you fit in terms of when you were born and where in the country you are.
Oh, do you know something?
So,
Can I just ask you something?
mhm.
Okay. If somebody, have a hysterectomy, let's say at the age of, let's say, 35, can that person actually request for a mammogram test before the age of 50 or 55? Can they request for that?
So yeah, that's actually an important question, Nana. So when I'm talking about breast cancer detection, I focused on mammograms. So mammograms are part of the nationwide screening program for breast cancer. We have a number of screening programs for different types of cancer, including rectal cancer. So that would be a poo test, for example, and other cancers that I'm sure we'll discuss in the future. But it's specifically mammograms for women 50 plus. If women are concerned about a risk of them having breast cancer in their family, or if they've got any kind of signs and symptoms that they're worried about, what we typically do for younger women is we do an ultrasound. An ultrasound is basically a probe that's put on the breast and in the armpit, and it's rubbed across with a bit of jelly. So exactly the same as you would do for a woman who's pregnant and you want to see how the fetus is growing. The reason we do an ultrasound and not a mammogram is because younger breasts are more dense. And if we do mammograms on these ladies, there's a higher chance that we'll have what we call in science as false positives. So there might be something that looks like cancer, but isn't cancer at all. And we don't want to subject these women to unnecessary investigations, interventions, and treatment that will not benefit them in any way because they don't have the cancer there. So with those women, more likely they'll have an ultrasound. If anyone has any worry that they have cancer and they speak to their GP, what we'll do is refer them to a 2-week wait. So within 2 weeks from the time that they've seen the GP, they will have an appointment with a breast clinic, and they will do various tests on the same day if it warrants it. So that might include an ultrasound. It might include a fine needle aspirate or a biopsy. So it's where they take a little punch biopsy, so a tiny bit of the breast tissue, so that they can look at it under the microscope and see exactly what's happening and see if there's any further investigations that need to be done.
Wow. Can certain bras also affect maybe certain pains that we experience in our breasts?
Absolutely. So if you're wearing the wrong kind of bra, so the wrong size, the wrong shape for your breasts, those things can contribute to pain in the breast. So it's really important to remember that pain doesn't equal cancer. A lot of cancer is actually not painful in actual fact. So that's something to bear in mind. But in terms of a discomfort in the breasts, if your breast has, so if your bra has wiring in that, that tends to be uncomfortable for a lot of women. Non-wired bras generally are more comfortable for women, but obviously aesthetically, some women want to have their breasts looking a certain way in their clothing, so they'll opt for a wired bra, which is fine. You just need to find one that supports you well and that isn't uncomfortable for you, and that is your size. So going to a reputable place and having yourself measured is very, very important. And if you lose weight or you gain weight, again, having yourself remeasured will ensure that you don't have an ill-fitting bra, and you're less likely to have discomfort as well.
Wonderful. So let's and still move on to the causes and also the symptoms. I mean, if you have more to say about it, otherwise then we can.
So I've covered most of it with regards to family history, etc. But another thing to be mindful of is the different types of breast cancer. So sometimes exposure to certain hormones can increase the incidence of breast cancer. So I know there's been a lot of talk about HRT in the past month or so. A lot of women are taking up HRT who are perimenopausal, menopausal, postmenopausal, as a way of managing those symptoms, such as hot flushes, mood swings, those kind of things. So when women do have HRT, that can increase their risk of breast cancer. So having the oral HRT can increase the risk. The only exception to that is vaginal estrogen. So the reason we might give some women vaginal estrogen is as part of the menopause, the vagina can become smaller and dry out slightly, because the reason that a normal discharge is produced by women who are in their fertile years is because of hormones. So the progesterone and estrogen balance throughout the month allows this normal discharge to be produced, which prevents infections, which prevents discomfort as well during intercourse. And just generally, when you're menopausal or postmenopausal, those hormone fluctuations are not present in the same way. And as a result, the vagina atrophies, so it gets a bit smaller, and the discharge lessens significantly. So we might sometimes give these ladies estrogen creams that they can put into the vagina, which encourages the lubricant, the mucus to be produced, and just makes things more comfortable for these women, so they're less likely to have itching and discomfort in that area. So going back to HRT, if women do have HRT, that increases their risk. But when they stop HRT, that risk is reverted back. But some risks can remain in place for up to 10 years after stopping HRT. So it's really, really important that before starting HRT, you have a very important conversation with your GP in terms of your potential risk factors, especially if you have a family history of breast cancer, because it's important to see what type of breast cancer you have, if it's estrogen receptor sensitive or not, because that can tell you if it's feasible for you to have any kind of hormone replacement therapy or even a contraceptive. So the combined contraceptive pill or the progesterone only or mini pill, as a lot of people call it, those things can be contraindicated. So be strongly advised against in certain women with an increased risk of certain types of breast cancer. So before you start on any of these things, it's important you have these discussions with your GP and you're fully informed about what you're doing and what the risks and the benefits are. So there's significant benefits to having HRT. So I don't want to mitigate that in any way, but it's important for people to know the risks and benefits with anything. As with any kind of medication, drug intervention, there are going to be risks and there are going to be benefits.
Okay. I just want to speak for also the people who, for some reason, it's a bit difficult for them to communicate very, very well in English when they visit their GPs. What simple things or simple sentences or like words can they say in trying to talk to their doctors? I mean, just a little bit of English. I mean, but then in a way that they'll be able to still make themselves clearer or clear to the GP, because sometimes there's I believe that the reason why most of us, it takes a while for our treatment to be achieved is because we are not able to communicate ourselves very, very, very well. So they just assume, oh, okay, maybe she's trying to say this. Meanwhile, your body very, very well. What can women, African women or women in the minority community, simple words that we can tell our GPs that they can pick, from or infer from what we are saying. That at least we are saying that we are trying to, communicate, our symptoms, or let's say our diseases to our GPs. What any kinds of, simple words or simple sentences or phrases of words that we can, because we have a lot of people with a lot of, diseases, but in trying to reach out to their doctors, it becomes a bit difficult. And so the treatment also takes ages. And as a result of that, yeah. So if there's anything that maybe you can educate us on in a layman's terms, please, yeah.
Absolutely. So in London specifically, we're very, very multicultural. So it's very common for in the GP or hospital setting to have people who do not speak English as their first language.
Okay.
And I would say to those groups of people who find it difficult to articulate exactly what kind of help they want or what kind of problem they have, even if they don't know what the help is to make it very clear that this symptom is unusual for you, is new for you, and is worrying for you, and is affecting you in some way. So if, for example, we're thinking about diabetes, so sometimes with diabetes, you might go to the toilet a lot, and that could be an indication that something's not quite right. So it could just be a urinary infection. It could be something to do with the kidneys. There's a lot of different things. But rather than sitting on it and thinking it's fine, it will go away, if it's something that's concerning you, it's probably something you should let someone know about. And it's very, very important that you let them know that it is a concern of yours and that's why you've come to them. And then as us as clinicians, it's up to us to be able to understand exactly what you're trying to tell us, and then make a decision as to how we need to help or intervene. So the one thing we do ask from you is, if you do have any worrying signs or symptoms, anything that's not normal for you, anything that's new, you just let us know as doctors in GP, in hospitals, wherever it may be. If it's something that's been going on for a while, or a few days, or half a day, whatever it may be, you let us know that it's something that is abnormal for you and something that you're concerned about. That's usually the key that will get us thinking more about what this problem is, because ultimately the diseases that tend to occur is something that changes from the status quo in the body to something else. And the sooner we get on top of that, the more help we can give, and the less likely that disease, whatever that may be, is going to progress. So anything new or different, you must express that.
Okay, so new, different, worrying, and concerned.
Mm-hmm.
About what you're experiencing. Okay, that's fine.
Mm-hmm.
So we are still on the symptoms, or maybe if we can move on to the next.
So we've gone from symptoms and causes, which I spoke about earlier as well. So we'll look at diagnosis. So I touched a bit about that when we were talking about mammograms and ultrasounds. So if I go into a little bit more detail about the next steps after that. So I spoke about a biopsy. So typically what a biopsy means is that a tiny bit of tissue is taken away from the area of interest. So wherever the breast lump is or the breast defect, we'll take a tiny bit of tissue away and look at that under a microscope. So that gets sent to a lab, and certain different stainings are done on that, and it's cut into tiny pieces and looked under a microscope by a specialist doctor, and any kind of abnormality is seen in there. So as I was saying at the beginning of this, when we were talking about what is breast cancer is an abnormal proliferation of cells that originate in the breast but are no longer doing what they should be doing in the breast. So when we look under the microscope, we're looking for those abnormal cells because we can see them, and we can see that they look different from normal breast tissue and normal breast architecture and structure. So that's one way. That's a biopsy. The other one is something called a fine needle aspirate. So if the lump there seems like it's filled with a bit of fluid, what we might do is put a needle in and draw some of that fluid out, and then put that onto a slide, stain that, and again have a look at it and see, do these cells look normal or do they look abnormal, and what kind of things do I need to do moving forward? So those are the two main ways that we would diagnose any kind of breast cancer. And other things that we might then do would be further scans. So if we have identified someone as having what we suspect to be breast cancer, we may then do further scans on these people, or women who've been confirmed with breast cancer, to see if there's any likelihood of spread. So we might do further biopsies in the armpits, especially, and we look at something called lymph nodes. So those are a type of system within the body that passes lots of fluid around, and these cancerous cells have a very smart way of going into those fluids and spreading around the body via the lymphatic system. So these lymph nodes. So when you get sick, sometimes you'll get these extra lumps that come up in your throat, for example, when you've got a cold or some sort of infection. Those are lymph nodes, but they're present all over our bodies, not just our neck. They're present in our neck, our head, in our armpits, in our bodies, in our groins, down our legs. They're present throughout our bodies in various amounts. And that's typically how a lot of cancers, not all, but a lot of cancers spread throughout the body, is via this system. So we can do other biopsies from there, and we can also do types of scanning as well. There's different types of scans. So there's MRIs, there's CT scans, and there's something called PET scans. So MRI scans use minimal amount of radiation, and they'll be used in certain circumstances. However, they take quite long. Most commonly, CT scans are used, and basically they're a series of many X-rays that gives us several slices of what's inside the body, and it allows us to see in greater detail different parts of the body to see if there's any spread of the cancer that's been identified. A PET scan, which is an electron scan, looks at how much what's the word? So how much the cells are working. So cancer cells tend to work over time. They'll be working 24/7 all the time, doing a lot more work than the normal cells. So they'll basically light up like a Christmas tree in this scan. So it will tell us if the cancer cells are confined to the one area that we think of, or if they're in other places. And that tends to be when we're monitoring disease response, or we're about to start an intervention and we want to see how well it's working. So we'll have one set of scans, then there'll be an intervention, which might be radiotherapy, chemotherapy, what we'll discuss in a little bit. And then we'll do another set of scans to see where we're at and see if that intervention has had a direct impact on the cancer that we've identified.
Wow, this is very scary now. Wow.
Yeah, it's a lot. It's a lot to take in. It's definitely a lot to take in. But I think one thing to remind people is that having any kind of cancer diagnosis can be difficult, but there is a lot of support. So you should never feel like you're alone, because there are ultimately other people. There are hundreds, thousands, millions of people who are going through something similar at any particular time. And as a result, there is lots of support available. Macmillan is an amazing support network, and it gives lots and lots of advice on living with cancer, dealing with cancer symptoms, kind of support that you can get if you have a cancer diagnosis, and what to do moving forward with whatever kind of prognosis that a person is given. So one should never feel like they're alone, and just talking to people often alleviates a lot of the anxiety and fear associated with the unknown when it comes to considering what may happen next with breast cancer. So I think that's just something important that people should remember. Okay.
So we are still on the symptoms.
So the diagnosis. So
diagnosis. Sorry.
So the diagnosis, as I was saying before, different scans tell us different things. And these scans together with biopsies, etc., will tell us what stage a cancer is at. So I'm sure a lot of people have heard of stage 1, stage 2, stage 3, stage 4 when talking about certain types of cancers, not just breast cancer. It might be cancer of the kidney, prostate cancer, whichever. There's different grades to it. And the reason for those grades is that it tells you how much it is spread, how big it is, and that information together then tells us the treatment options available, and also a prognosis and likelihood of success of either eradication or slowing down of that particular cancer. So, and that's based on many years of research and evidence base that gives us a good idea of exactly what would happen with a particular stage of cancer and the particular location of the cancer as well. So those things are really important.
Okay. So what kind of questions, should one ask after being diagnosed with breast cancer? I mean, in terms of their treatment, what kind of questions, should they ask after being diagnosed with breast cancer?
So I think what's important is to digest the diagnosis first and foremost, and be in a state of mind that you can absorb any kind of information that you're given. And when it comes to asking questions, I think important things to ask about is what happens next? You know, what does the next step look like? And that in itself will alleviate concerns for you. Having said this, a lot of times they will tell you what's going to happen next, when your next appointment is, when, you know, the next biopsy may be, and also prognosis. So that's another thing that people are quite keen to find out. And sometimes the opposite as well. Some people don't want to know. So in terms of important questions, it depends on the individual, but knowing what the next steps are, not necessarily the prognosis or exactly what's going to happen, but knowing what the next steps are is usually very, very important, because it gives the patient, so the person who's been diagnosed, a sense of autonomy and control over what's happening. So being able to understand each thing in each stage is very, very important. Don't be afraid to say what happens next, rather than you waiting to be told that this is going to happen, or you're being told that there's an appointment in so and so time. Ask what is going to happen during that appointment. What should I expect? These are really, really important questions that will alleviate any anxiety that you may have, and also will stop you looking for things online that might completely derail you from what is actually likely to happen in terms of next steps.
Wonderful. Dr. Zainab, please, when you're ready for us to talk about the images that you sent me, let me know so that we can just project it. So
The images.
yes, you know the picture that you sent.
Yes, yes, yeah. So yeah, so if we go back a little bit actually, so I shared with Nana some images of the breast in terms of the signs and symptoms. So if Nana, you're able to show that, yeah. So here is an image of different types of breasts. So as I was saying, in this picture that we can see here, it tells us the different kind of things that we should be aware of. So I'm just going to have a look at it on my phone because it's a bit smaller there, so we can go through each one very quickly. So the first picture shows a lump or a swelling in the breast, which we discussed. So that could be in one breast or both. So what's really, really important is that we don't assume just because there is a lump in one breast and there's a lump in another breast that it's okay. Unilateral or lumps in both breasts warrant further investigation, especially if it's new and it's not normal for you. The other thing, as I said before as well, is skin changes. That might be color changes, that might be texture changes, that might be altered sensation on the breast tissue as well. And the other thing is a change in the nipple, as I was saying before, the nipple going inwards as opposed to outwards. And that's usually a sign that there's something pulling on the nipple from inside, stopping it from being able to protrude the way it normally would. And any kind of rash as well, which is the second line of the image that you'll see. So rashes on the breast, especially on one breast, are not normal and would warrant further investigation. It might be something simple like a simple yeast infection, for example, that will clear up with a topical treatment, or it might be something that warrants further investigation. And as I said before, discharge from the nipple. I think the other thing that I didn't mention is that men with breast cancer, any discharge from the nipple in men is abnormal. There is never any normal discharge in men. So if men have any discharge from their breasts, from their breast tissue, from the nipple area, they must see their GP, because it's usually a sign of something untoward until we can prove that it's not. So you must see your GP.
Wow.
And the other ones, as I said before, are pain and changes in size of your breast. So we all have different size breasts, but if one breast becomes particularly larger or abnormal in terms of its shape, that's something that warrants further investigation.
Wonderful. Yeah.
Okay. So in terms of next steps, the next thing to talk about would be treatment.
Yeah.
So treatment for breast cancer depends on the type of breast cancer that one has. So you can have a breast cancer in situ, And when we say in situ, it means it's in one place. It hasn't spread anywhere, and it's usually confined to a particular part of the breast. That kind of breast abnormality can be excised with surgery. So it can have curative surgery. So all you need to have is that particular area removed and your treatment's complete. And then you might have some surveillance.
Okay.
Other types of breast cancer might require chemotherapy or radiotherapy. So chemotherapy involves, as the name suggests, chemical therapy. So that will be certain cytotoxic, what we call agents. So cyto and toxic. So cyto means cells, and toxic means to cause damage to. So it's basically a chemical that causes damage to cells. And the thing with this damage is it's often very indiscriminate. So it will kill the cancer cells, but it will also kill some of the normal cells, which is why people get a lot of those other side effects like feeling unwell, hair loss, weight loss, all of those things associated with chemotherapy. Radiotherapy, on the other hand, is more specific and more targeted, and it's an external kind of treatment. So it will have a certain amount of radiation that is targeted to a specific area in the body. So in breast cancer, you can have that done usually after surgery or chemotherapy, or during chemotherapy, to or before even, to target any areas of breast cancer cells that they think may proliferate, that might not have been able to have been seen during surgery, or might not have been targeted as easily with chemotherapy. So people will have it in combination, or one or the other, or the other. So you might have just surgery, might have just radiotherapy, might have just chemotherapy, or you might have a combination of all three, or two out of the three.
If anyone has got any questions, Dr. Zainab will be more than welcome to answer all your concerns. So, yes, I mean, more than welcome, yeah, to answer your questions or your concerns. So, if you have any worry, thing on your mind, please don't hesitate to put them in writing. Yeah, you can WhatsApp me. I've got my phone. Yeah, you can send it to me if you don't want it to go live on Facebook. Yes, you can send it to me. I'll read it loud for Dr. Zainab, yeah, to answer those questions for you. Thank you.
So just going back to the treatment a little bit more. So as I was saying, the side effects of the treatment can vary, but one thing that's really important, and that all patients in chemotherapy specifically are told, is that there is an increased risk of people becoming very unwell with what most other people would consider a simple infection. So chemotherapy depletes the bad cells, so the cancer cells, as well as the good cells. So all of those things will drop. Patients may often need blood transfusions. They may need transfusions of platelets, which is another constituent of the blood, which is a conversation for another day. But these people are at increased risk of becoming very sick as well. So if you're someone who's having chemotherapy, if you have a new onset cough, or you feel unwell, you have a temperature, all of these things are a sign for you to go straight to A&E. You don't go to the GP, you don't wait until the following day, you go straight to A&E, because it could be a sign of an infection that can become overwhelming very, very quickly, because the body's normal defense mechanisms are down as a result of chemotherapy. So an infection in someone who has very low white cells, which is something else that drops, is a medical emergency. And that's something that requires immediate hospital admission and immediate antibiotics through a vein, so an IV line. And these people are closely monitored, because there is a level of mortality, so death associated with people who get infections as a result of having chemotherapy. So chemotherapy obviously is not without its risks. And that's partly why during the COVID pandemic, when it was at its peak, a lot of people weren't being given chemotherapy, because there was a significant risk that these people would be left more exposed to COVID and were more likely to die as a result of having COVID if they had that chemotherapy in a shorter space of time than if their chemotherapy was delayed in terms of the cancer progressing.
Wow.
So that's some of the types of treatment that we have with breast cancer. The other thing to be aware of is hormonal treatment. So I spoke before about HRT and contraceptive pills. So in some women, tamoxifen, for example, can be suitable for them, but that's in a very specific group of women. And I'll read out exactly what it says on the NHS website. So it says tamoxifen stops estrogen from binding to estrogen receptors on cancer cells. So these cancer cells have positive estrogen receptors. And when there's estrogen present, these cells proliferate even more. So they grow even more. And there's a tablet or a liquid that you can take called tamoxifen, and that targets those cells specifically and stops them proliferating. So women with those specific types of cancer cells can benefit from this particular type of hormone therapy. There are also other types, but again, that's specific to the type of cancer that you have. So another example would be Herceptin. There's also genes, as I was saying before, that have an increased risk of breast cancer. So if you have certain types of risks of breast cancer, you might also be given the option to have your ovaries removed, especially if you've completed your family. So that's another form of treatment. Although it's not directly to the breast cancer, it's the same kind of causes of breast cancer that can lead to ovarian cancer. So you might have heard of some people having mastectomy. So that's complete removal of the breast and removal of the ovaries. So I think the most well-known example is Angelina Jolie. So she had both breasts removed and her ovaries removed after she completed her family. I'm not sure if she had anything else removed, but I know she had those two things removed because she had a significant family history of genetic defects associated with that. So again, the treatment is specific to the type of cancer, and that depends on what a person is diagnosed with and what stage they're at. So it's a lot of things to think about, but again, cancer treatment is individualized. And I think another important thing to just touch on is that when treating patients with cancer, it's a multidisciplinary effort. So it's not just an oncologist, it's the breast surgeon, it's the specialist nurse who specializes in oncology or breast cancer specifically, it's the physiotherapist, it's the occupational therapist, it's the general ward staff, it's the nursing staff, it's the doctors that you may or may not see for other things such as endocrinology input. All of these different people come together and discuss each individual case one by one and decide on the best course of action that is tailored to the specific person and their specific needs and their specific cancer. So something to bear in mind is that the gold standard treatment for some people may not be the gold standard treatment for others. So very, very invasive treatments such as radical surgery might not be suitable for people who have multiple comorbidities. So someone who's more elderly, who might have problems with their heart or problems with their lung, it might be simply unacceptable to put this person under anesthetic in attempt to remove the affected breast tissue. Instead, we might do something like a combination of chemotherapy and radiotherapy, or one or the other. And that's not because we don't want to do these other interventions, is that it's just that the risk is simply unacceptable. So the gold standard might be for a particular type of breast cancer that a person has is to do surgery, radiotherapy, and chemotherapy, but this person simply isn't well enough to survive all three, that we might make a compromise and do what's best for the patient, improving their quality of life and just generally trying to improve their life living with the type of cancer that they do have.
Dr. Zainab,
So,
can I just interject here?
yes.
In terms of the treatment,
Mm-hmm.
Can someone be in denial that can prevent that, such a person from getting treatment?
So could you repeat the question?
After being diagnosed
Mm-hmm.
with breast cancer,
Mm-hmm.
can there be a situation where a patient can still be in denial, and as a result of that, I'm just refuse treatment?
Yes, absolutely. That does happen.
Okay.
I've met plenty of patients who either because they're in denial or because they simply don't want treatment will refuse treatment. And again, the NHS in this country works on an ethos of patient autonomy. So that's the patient having the right to refuse a treatment, even if it's considered by the clinician to be in their best interest, because we have a right to decide what we do or don't want to do with our bodies. And the definition of that is autonomy. So people may decide not to have an intervention for various reasons. And I think the most important thing that we can do as clinicians is find out what those reasons are and see if they're legitimate. Because a lot of problems is that misinformation is passed down to these people,
Mm-hmm.
and that's a lot of the reason as to why they don't want to have certain interventions, because they've heard or they've been told that this thing will shorten their life or will have such serious side effects that it's just not worth it. So it's important to have a frank discussion with these people and say to them, what are your concerns? Why do you not want this treatment? Rather than just accepting a no, because it might be that there's a middle ground. So even if some of their concerns are well founded, so they're worried about losing their hair, they're worried about vomiting, they're worried about being underweight, they're worried about having no energy. These are all legitimate concerns. So you can find a middle ground and say, okay, so you don't want this kind of chemotherapy, maybe we can consider this kind of chemotherapy, or we can combine it this way. Those kind of things are things to talk about and discuss, because ultimately it's the patient and what's right for them. And the patient is an individual. This is a person. This is not just a breast with cancer. This is a human being who wants to do certain things in their lives, wants to have a certain kind of life, live a certain way. So as clinicians, we treat people, we don't treat diseases. We treat the individual.
Okay. Can I ask you something that is more found in our community as well? Because sometimes we tend to combine herbal, treatment with scientific interventions as well.
Mm-hmm, mm-hmm.
Um, you know, where do we strike the balance? Like when you come across a patient who is so bent on having, herbal or let's say traditional intervention.
Mm-hmm.
But at the same time, you could tell that if this person is not given immediate intervention, maybe it might spread to other parts of the body. At that point,
Mm-hmm,
what do you do
mm-hmm.
as clinicians? What do you do?
So as a clinician, um, I would remind patients that a lot of what we do is what we call evidence-based medicine. So if we're doing something for someone, there is an evidence base that tells us that this is the right treatment at the right time for the right patient. And as a result, we're offering them the thing that we think is most likely to work.
Mm-hmm.
A lot of these herbal things that people have are varied in nature, and the studies done on them are limited. So we don't have a lot of information. That's not to negate the benefits of some of these things, but a lot of the time the information that we have is limited. And as a result, we cannot confidently say that they can have this as opposed to the treatment that has a good evidence base and has a good track history of halting cancer or stopping it, or removing it altogether.
Wonderful. Because no, I'm just speaking for the whole community because we have all kinds of things going on. You know what I mean?
Hmm.
So I'm
Hmm.
thinking, we should cover all the concerns that really, affecting us in terms of the herbal interventions, in terms of,
Absolutely.
the kind of treatments, that is
Yeah,
also,
and
yeah.
it's not to say that there's definitely not a role for some of these things. So changing your diet to have more nutritionally beneficial foods, so less processed foods, the benefits of having like juicing and things like that. There are clear benefits with that. You're increasing your intake of fruit and vegetables, which is something that we regularly encourage. You're reducing your intake of processed foods, again, which is something that's very good. So you're more likely to get nutrient-rich foods in your diet. So those kind of things, from an alternative medicine perspective, definitely have their benefits and should not be negated in any way. It's just striking that balance. I would say, though, with some medications, if you're taking them, some herbal medications can interact with them. So if there is anything that you're taking, run it by your GP or your doctor, whoever's looking after you in the specialist service that you're under, so that they can be able to see if this is safe for you to take with whatever treatment you're having at the same time.
Good. Good. Yeah. So let's continue with our discussion.
Okay. So the last stage is living with breast cancer. So living with breast cancer is something that is a difficult kind of thing for people to accept. They often see it as a death sentence, something that means that they're going to be restricted in some way in their lives, and something that means that they can't do anything. And that's simply not the case. As I was saying before, there's a lot of support when it comes to looking after people with breast cancer, and that includes psychological support and ways of managing symptoms, and also ways of managing finances as well. So there is a lot of financial support for people with cancer, and that can include free prescriptions, that can include support in the home. Lots of different things are available for people with cancer diagnoses that make their lives just a little bit easier. And moving on from that a little bit in terms of follow-up and recovery, people who've had treatment and intervention and they've been considered cured, or in remission rather, those people will still have surveillance for a certain amount of time, until it's deemed that they no longer need surveillance, or the interval between the appointments gets bigger because of the length of time they've had without any signs or symptoms of disease. And I think lastly, the important thing to consider is, well, actually two things, is what happens to your breasts at the end of this. If you have what we call a lumpectomy, so a tiny bit of the breast is removed, then your breast will look slightly different. There'll be a scar. The shape won't be as smooth anymore. And usually that's it. If you have a mastectomy, the whole breast is removed, and you have the option for reconstructive surgery. And depending on who you are as an individual, your habitus, how big you are, what kind of treatment you're having, you can use your own fat to reconstruct the breast. And the alternative is an implant. That's also something. Alternatively, some women just prefer not to have any reconstructive surgery as well. All different ways are completely acceptable and are completely normal. There is nothing abnormal with having one breast because one has been removed as a result of cancer. It's just a new way of living. That's all it is. And it's about being comfortable in that way of living. And if it means that you're healthy and you're able to live longer with one breast, so be it. You shouldn't feel compelled to have reconstructive surgery if it's something that you don't want to put yourself through. And I've noticed a lot of the campaigns recently are empowering women to accept their bodies in their new states, especially after breast cancer surgery. So I think that's something really important for women to consider as well. And I think the last point to touch on is, we've spoken a lot about breast cancer awareness, prevention, diagnosis, treatment, all of those things. And we've touched on prognosis. But I think one thing we should also consider is if treatment doesn't work. If treatment doesn't work, what happens next? What does that mean for that patient? it obviously means that, their lifespan will ultimately be shortened as a result of this disease that they have. And what that means for that person is different depending on who that person is, how old they are, what kind of support network they have, and the kind of support that they have will look different. So I just want to talk a little bit about palliative care in this group of people. So palliative care, a lot of people consider palliative care as the doctor has given up on them and they're going to die and that's it. It's not the case at all. Palliative care is a different type of medicine. It's a type of medicine that focuses less on cure and more on managing your symptoms and how you feel as an individual. And it's multifaceted. So medication is one area, but also how your family is coping, how you are coping, and also your spiritual well-being as well. Is These are all things that are very, very important when it comes to palliative care. And I think this is something that I just want to really, really stress, that palliative care doesn't mean that you're going to die straight away. What it means in a very sort of textbook way of thinking about things is that these people are likely to be in their last year of life. Having said that, there are some people who are in a palliative care treatment facility who are not dying, but have a life-limiting condition, which means that they will benefit from the input of palliative care specialists that will help with their symptoms. So someone with advanced breast cancer can have a multitude of symptoms. They can have pain. Pain is usually a significant thing. As the tumor progresses, it goes to the bones, it can go to the brain, and that can cause a lot of different types of symptoms, pain being an especially important one. And another thing to consider is how we manage that pain. We can start very simply with things like paracetamol, and the next step up in terms of cocodamol, ibuprofen, which we call NSAIDs, which are non-steroidal anti-inflammatories, and move up. We have something called the pain ladder in medicine. At the bottom is paracetamol, and at the top is morphine, and it's chemically similar alternatives. And patients can receive this in varying doses depending on how far along they are in their disease progression and what kind of symptoms they have. And we have specific medications for patients with specific symptoms. So some people, especially towards the last weeks and months of life, might become increasingly confused. We can give them medication that helps to reduce that level of confusion and keeps them calmer. We can give them medication that helps with hiccups or excess, what's the word, saliva production or fluid production from the lungs as well. All of these things can help to support a patient as they progress with their illness. And I think it's important to understand that there is life and there is death, and it's something that everyone will come to at one point in their life, and it's about being able to cope with that eventuality, if it's expected or unexpected, and feel supported as you make that journey in that next stage of life, essentially. So it's not a case of running away from something, it's a level of acceptance and having the right support to feel supported ultimately, and to know what is to come, and to feel that you are in a safe space, and that you have adequate support, essentially.
Wow. This is so moving. But, most of us, we are so busy, especially our grandmothers, our aunties, back home.
Mm.
We have a lot of women in the farming industry.
Mm-hmm.
And also, some of us Like we are so busy that we don't even, get time to listen to our body, what's actually
Mm,
going on in our bodies. What kind
mm.
of advice do you have for women everywhere as to how to take care of ourselves? And then two, if someone is being diagnosed with this disease,
Mm-hmm.
how do they break the news to their families, especially the children,
So,
involved? Yeah.
so I think what's important is having very specific ways of talking to family members. So, when you're talking to young people or small children, you will discuss things in a particular manner. When you're talking to older people, you will say things in a particular manner. I think what's important is to understand what people are and aren't able to digest at a particular moment in time. And you can be supported in having those conversations. So you should never feel that if you've had a particular diagnosis, it's now up to you to then convey that message. You can, I don't want to use the word delegate, but you can ask someone else to do that for you if it's easier for you, if it's less daunting for you. You can get the support of the doctors that you're under to do that for you. And there's lots and lots of resources available for helping to explain cancer to small children, especially when it involves a parent and how they are being affected by it, and ultimately even the death of a parent, and what that looks like for a young person, and explaining that in a way that is understandable to a young person so that they can process it in a way that isn't traumatic for them. I think that's the key thing, is acknowledging the information and accepting it as information, but giving it and delivering it in such a way that makes it easy for that person to digest. And the news itself is not the is the main thing you're focusing on, rather than how it's been delivered.
Wonderful. And I think I asked about, how busy, women are these days, especially those in the rural, areas that find it
Mm-hmm.
so hard and to listen to their bodies. What
Mm,
kind of, how can they, get to that point and feel that, okay, like in spite of me being a hard-working woman, I feel something not too, well, I'm going on in my body. What are some of the things that you can tell women out there in trying to say, at times just stop and listen to your body. You know what? Because we are so busy, we are giving birth to children, we are going to work, we are doing, I'll say that we are just multitasking.
mm,
And I'll say that, look, we are the last people to sleep and the first people to wake up. And we
mm,
are constantly tired. So
mm,
it's so hard for us to even know what's actually going on in our bodies. And I don't know about you, but most women, you know, I would say, back home, they're so busy. But then the
mm,
medical system there is not as advanced as here.
mm,
So I'm speaking for them as well as to how maybe they can go about some of these things.
mm. So I think, no, in fact, you've answered a lot of your own question in that. Yeah, you have,
Yeah.
in that taking time to stop
Yeah.
and be aware of yourself, and that idea of self-care, and just taking a moment for yourself. And that shouldn't be seen as a privilege. It should be seen as a normal part of functioning. So taking time to listen to your body. So if you find yourself doing things differently and you don't know why, think about why you're doing that. So I think a good example in medicine is esophageal cancer. So a classic way of advanced esophageal cancer, so that's cancer of the throat, where the food goes down, so not the windpipe, but the part where the food connects into the stomach, etc., is a patient who eats normally and then might start to eat slightly softer food because they're finding it difficult to swallow, but they've ignored it. And then months and months go by and their food is getting softer and softer. So they went from eating steak and chips to now eating, a steak pie, to now eating a chicken pie, to now eating mashed potato and fish. And so no more steak. And then, they've stopped doing that. And now they're drinking more. And because they're finding swallowing food difficult, and they're just drinking and they're not eating as much. And then by the time they see their doctor, it's because they're choking on fluids. And that's usually because the tumor has got so big that it's very difficult for them to swallow. So the size of their esophagus went from being like this to being smaller and smaller and smaller, so that very little goes through. So those kind of people listening to your body rather than working on autopilot and automatically shifting how you do something because of an inconvenience that you feel is the first sign that something's not quite right. If you find yourself doing things slightly differently than you normally would because that normal thing is no longer comfortable or easy, it may be a sign that you need to go to your GP or you need to get further interventions done. And that's usually the earliest signs when we start to make adaptations for ourselves without even realizing it.
Thank you so much. I would just want us to put, the NHS link, so that if anybody wants to, read more about breast cancer, they can just read for themselves to be more informed about this deadly disease. If you can have it on the screen, please. That's the NHS website. Sorry.
So it's the NHS website is nhs.uk, and it's a website that will link to many different diseases. It's quite easy for you to find. So if you were to search breast cancer and then write NHS at the end of that into a Google search, the first result that you should get should be an nhs.uk webpage. And if you click on that, it will give you different kinds of links. I'm just trying to see if I have it. Yeah. So here it's a bit difficult to see, but on here, this is basically what it looks like. And you can see what we went through was the symptoms, the causes, diagnosis, treatment, living with breast cancer, and prevention. But we talked about prevention a bit earlier on. So this is the format of the page. And then each is a hyperlink that you can click on that will give you every single thing. So this page focuses on symptoms. And then there's another one, for example, at the end of it, that focuses on prevention. So you'll see it's like this. So that's generally how the website looks.
Looks like, okay. The technical team is just trying to...
yeah, it's there now. It's along the bottom.
Okay. Yes. So if you can just actually click on this and then just read more about breast cancer to be more informed about this. So in your final words, what do you want to say to our people, our viewers out there watching? I mean, we've got a lot of comments, but after you've spoken,
so I think
sorry, might have to read them out. Sorry.
Yes. Do you want to read some of the comments out? Is that what you
please.
said?
Yeah.
Yes, of course.
If you can read a bit of the comments, please. Okay, can we have Hajia Alima Sajitu? She goes, very good, thanks, Nana. I've got Clay Danso all the way from America. Sorry, this is Vida, sorry, the Diakon. And she goes, yeah, she's in the UK. She says, very educative and insightful program. Thank you both very much. Host Nana Abno Swahigan, that's me. And then Dr. Zainab Ganiyu-Dada.
My pleasure.
Says, God richly bless you. And then I have Clay Dance also from America saying, Nana, great. God bless you both abundantly. And I have Alex Higgin, that's my husband, also saying, great eye-opener discussion. And there's also Kofi Amwating, also in Bradford here, from Young Spice, saying relevant, very relevant revelations. I pray that our beautiful women will take this serious. Thank you. And I have Naya also saying, God bless you, man of God. I've got Dr. Sahil Ibrahim Ahmed also saying, thank you, Nana, for highlighting this topic. This is a huge public health concern that is relevant to everyone, not just women. Thank you, Dr. Zainab, for taking the step to inform the public about this condition. And also, I've got a couple, John, Ben, as I saying, very impressive. And I think I've got one from, the Pastor Abuaje, also saying, God bless you richly, Nana Hagen. Yeah. There's a lot of comments. We can read everything, but unfortunately, I wish maybe we could have had some questions, but all the same, I know people are busy, so obviously maybe they might and send their questions maybe in their subsequent, maybe in our subsequent discussions.
Yes.
Hopefully, yes. So
absolutely.
If you can, yes, give us your closing, remarks or anything that you want the public to know. I'll be so happy, please.
Okay. So first of all, thank you, Nana, for inviting me. I'm very grateful that you've given me this platform to be able to speak about this this topic that's very, very important, and for varying reasons is important to different people for different reasons. So I think in terms of things for us to think about moving forward is that breast cancer is something that affects men and women. It's something that can affect the young as well as the old. And also that early diagnosis means better outcomes. So you're more likely to have a treatable disease that's caught in its early stages. And as a result, the treatment that you get is more likely to be curative and less likely to just prolong someone's life in the short term. So I think in summary, early diagnosis via surveillance. So that's looking for the signs and symptoms that we've discussed, educating yourself. So going onto this website and educating the people around you. So your children, your mothers, your aunties, your uncles, fathers, whoever, everyone should be educated on these things. It may affect one particular gender. And it's true, I did say it does affect men as well, but on a much smaller scale. But it's important that we all are aware of these kind of things so that if we do see any signs and symptoms, if someone says something in passing, we are educated enough to be able to advise them on what to do. So educating ourselves and educating others, I think is sort of the last thing that I really want to say is that knowledge is power essentially, and the more we acquire, the better we are at dealing with things when they arise.
Thank you so much, Dr. Zainab, for taking some time out of your busy schedule to educate us tonight. I'm so grateful to you for the knowledge that you've actually spewed out. I'm so grateful, and also the viewers are also grateful to you. When it comes to health topics, it's a bit technical, and that is something that I'm trying to try and be on top of it. But obviously, that's why I've left it for the experts to educate us on. And to anyone watching, breast cancer is real. I know that look in our community, we have a lot of secrecy, around us in terms of not wanting to know, and in so doing, it affects our treatment. I would just urge you, just like Dr. Zainab said, knowledge is power. If you're knowledgeable about a condition, it helps your treatment. It makes your treatment easier. So, like, in order not to worsen what we're already going through, anytime you experience or you notice any changes in your body, don't hesitate to speak to your doctors about them. And also, we've also been told about the kinds of food that we should stay away from, the processed foods. We should exercise more. We should eat more greens, and also we should be educated on some of these things. I've learned a lot. When it comes to cancer, I'm a bit emotional about it because my own father died from it. So when she was actually mentioning some of the symptoms and especially the latter part, it really got to me because I could just remember everything, and I would just end by saying that if you've been told that maybe you've been diagnosed of breast cancer, it's not the end of the world. There's treatment, there's help, there's support. That's why we have doctors well, versed in what they do. And it's not easy, but I'll say that there's help, there's help, there's help. So get educated. So on that note, thank you so much for, I'll say that for your company. Thank you so much for being a part of tonight's discussion. I would have loved, to have more questions coming in, but unfortunately, we might just have to, end it that way. Thank you so much, Dr. Zainab. Thank you. Thank you. So until that time, maybe we'll come your way with another health, topic. I'll say good night to everybody on the line. Thank you so much.
Thank
Bye-bye.
you.